Hi, and welcome to Blueprint to Heal. I'm really excited to have Dr. Larry Miller today. Hi Larry, thank you for
Hi,
joining me.
Nancy. Thank you for having me.
So, when I first moved to the Philadelphia area, I want to say that was like 15 years ago. You were the guy. Like, I started a Facebook, a parenting group back then. And, when people were looking for a really good doctor, your name came up over and over and over again. And, you know, honestly, I don't go to medical doctors, but like if I ever felt like I needed to, I wouldn't have considered going to anybody else. You were the guy. So
Well,
I
thank
don't know if I ever told you that, but I wanted to mention it.
no, no, well, thank you. That's very kind.
Well, it's true.
Mhm.
So anyway, you and I really maybe started to get to know each other maybe about 4 years ago. And, we were just getting to know each other personally slash professionally. And you just have this really great demeanor. When people talk about a good bedside manner for a doctor, to me, you're the guy. Like, to
No,
me, having a doctor you feel safe with, that you can open up to, is very important. I'm sure you've been told that before.
yes, well, thank you again, Nancy. I think that's the most important factor is being able to develop a strong relationship and rapport with one another so that there's a level of trust, because if a patient can't trust me with their most confidential or personal information, it's not going to go as far as well as it should. I mean, that's really paramount is that initial discussion, developing the relationship in order to discuss everything about what's going on in that patient's history. So I totally agree with you. It's that first impression and meeting and developing that relationship is really important.
Would you say that's one of the most important things is taking a really good history?
The most important, yes. I find most of the time I can come up with a diagnosis, and I think many practitioners can just based upon the history. And just spending that time delving into every detail from, I go back as far as birth and some even senior citizens to try and figure out, like, hey, was there any birth trauma that could have started them down this path towards illness or malaise? So, yeah, the history, and sometimes well, in many cases, it's quite extensive, but that I find is the most helpful in determining what the underlying root issues are.
And it's funny you say that because when I was in chiropractic school, so I'm a chiropractor, you're an osteopath. So you've been trained medically, right? And I've been trained really to look at the whole body. But I
Right.
realized that you're not a traditional medical doctor. You don't follow traditional way. But one of our professors, I remember telling us one day, is, take a good history because if you listen to the patient, they will tell you exactly what's wrong with them. Like you just have to listen. And, I was lucky to have a teacher like that, professor like that in chiropractic school. I graduated in 93 and I really took that to heart. And I don't know how many doctors really do that anymore.
It's much more of a challenge nowadays with the current system. You're allotted 8 to 12 minutes. Well, I'd say up to 15 minutes, but the average visit's about 12 visits per patient in the traditional fee-for-service model. And you're just very limited with what you can do in that kind of time. So often, if you can't figure it out in 10 to 12 minutes, you're going to be referring out to specialists and ordering many studies. You can't delve into the history to try and ascertain what's going on, with
Yeah.
someone.
But wouldn't you say that's like a really big frustration on a lot of patients' part? They go to the doctor, and in some cases they've been dealing with issues for years, and they go to the doctor, and the doctor's, may not be looking at his watch, but may be looking at his watch or her watch. And instead of being able to figure it out or at least have a good idea, they order all these tests. And it, and correct me if I'm wrong, because again, you're the medical, professional here and not me. But to me, it seems like you can order a lot of tests and you may get some answers, but are they the right answers? You know what I mean? Like you could go
That's
off on a wild goose chase because something comes up on a lab. So to me, that history is like really so important.
Yeah, 100%, Nancy. I mean, there are many times with lab testing that we'll find many of these incidentalomas. You're not looking for something, you find something else. And in some cases, yeah, that could be very helpful. But you're like you're saying, you go on this goose chase, and before you know it, it's taking you quite a while, and you're putting patients through more and more testing, and it winds up coming out with nothing, just because you keep pursuing that test instead of focusing on the history and tailoring your testing based upon that. So
Yeah.
yeah, it can cause harm in certain cases where people are going for like unnecessary biopsies when they don't need them.
And I know there's a lot of talk, I know that I've heard oncologists say this that, sometimes something will show up or, they're looking for something else and then some cancer will show up and, I know there's been talk about this maybe in the last 10 years that maybe people had these serious interventions that maybe they should just let it be and, see what happened. And I realize you're not an oncologist, but I'm just curious what you think about that because, cancer is the second leading cause of death in this country. And it's one of the things that drives me crazy that after all these years, and again, I wasn't planning on talking about cancer, but it just like kind of popped up in my head as we were talking.
Sure. Well, like you're saying, yeah, cancer is number two, right? Heart disease, cardiovascular disease is number one. And it's what is causing those disorders. I mean, we could put names to all of these diseases, whether it's dementia, metabolic syndrome, diabetes, but why? Why do we have those conditions? And what's leading to cancer? Because cancer is when the metabolism has gone astray. And we have to think of like what has caused it. I mean, sure, there can be a genetic predisposition, but in most cases there is an environmental trigger as well. So if we can work on that, and in most cases, I'm really focusing on lifestyle if I can. It's also working on any other underlying etiologies. But if we can say, hey, how's your diet? How are you exercising? Are you sleeping well? What's your stress level? Are there toxins in the home like mold? All of those factors, if they've gone awry, are going to cause inflammation in the body or oxidative stress, which is going to lead to disease. And some people get cancer, other people get heart disease, others get dementia. It's just a different, variety of disease in the body. So, um, it's just trying to figure out like why somebody is becoming sick. And often, like I said, if we get somebody working on those lifestyle interventions, things tend to improve dramatically.
Yeah. So what made you decide to go into medicine? Like what's your backstory?
Oh yeah, it's a great question. So back in, I guess, like high school, I realized like, yeah, I had an affinity for science and I did fairly well in math. And, as I'm moving into college, I said, well, what can I do with those skills? Could I go into the pharmaceutical industry? Could I be a scientist? Or medicine? And I actually, my mom was getting ill at that time, I think just around high school. And we were frequenting, our family doctor uh, often. And he's an osteopath. And I saw him intervening with some osteopathic manipulation and just taking more of a holistic approach. And I was seeing some of the improvement with my mom specifically. I'm like, wow, this is really interesting. So that was one of the other factors, besides, like I said, like doing like enjoying science and math and just being one of the fields that a lot of people decide to pursue when they have or they find that they enjoy that more or have more of a proclivity for that. So when I saw that, I'm like, oh, and I didn't know anything about osteopathic medicine at the time, outside of like I said, oh, our family doctor's a DO, but I really knew nothing more of that, but what he did. But I didn't know the difference between an allopath and an osteopath. And sure enough, then I got into college and it just reaffirmed when I was, with the sciences and And then I was doing some volunteer work at the hospital, and then I was like, oh, I really am enjoying just the patient interaction. Um, so that's what made me then pursue. And then I'm like, which route do I want to go? Do I want to go the allopathic, osteopathic? And I really decided I like the osteopathic approach, yeah, being more holistic and also getting the hands-on training to do osteopathic manipulation. So yeah, so then pursued that. And then I really enjoyed his approach, our family doctor's approach to medicine, and said, I really want to, emulate him. It was, which field do I want to be? A surgeon? Do I want to be a radiologist? But like I said, he really gave me the inspiration, with just how he was helping not only our family, but others as well, to pursue family medicine as an osteopath.
Did you grow up in the Philadelphia area?
No, I grew up in New York.
Oh, right. Yes, of course, the accent. How could I forget it?
Long Island, right?
Long
If I could get
Island.
rid of that accent.
Long Island.
Still after being here for over 25 years, I still can't get rid
So
of it.
I went to a chiropractic school in Glen Cove. So the school
Oh yeah.
moved to upstate New York. There was an osteopathic school across the street from where I went. Is that where you went, or did you go?
That's where I went.
Okay.
Yes, yes. The New
When did you
York Institute.
graduate?
I graduated in 96.
God, we almost crossed paths because I graduated in 93.
Yeah.
And I used to go to their library to study because
Wow.
we didn't have a library at our school. We had like one building. It was it was a commuter school, so you had to rent a place. Like me, I had to because I wasn't local.
Sure.
And then when they moved to upstate New York, they kept a clinic down there. But I used to study in that library, and the osteopathic students were actually shocked that we were using the exact same books that you guys, Netter's
Right.
and Guyton for
Yes.
physiology. And
Sure.
they were like, well, you're just a chiropractor.
No, no, yeah, you guys the same background training as
That's
far
so
as
funny.
the sciences. Yeah.
I just assumed, I guess, that you went to PCOM because you practice in Philly, but you and I never talked about that, so that's kind of.
Right, right now, so I did my residency in Philly. I decided I
Mm.
wanted to go into a different region. I was ready to move from New York, and then we decided upon, Philadelphia. And then I trained there and then got my first job, and then I just continued to started our life and family here, and yeah, everybody's remained here.
And,
So
and it's funny because I've only been to osteopathic doctors also. Like as a kid, we had our family doctor who was an osteopath, but he didn't do any manipulation. And then in my 20s, I started going to the guy who was like running the clinic at PCO or OMCP. I never really sure which one to call it.
yeah,
And when he found out I was going to chiropractic school, he was so pissed off at me. He was like, come here, and I didn't want to learn. I didn't want to do anything with blood and guts, and
sure.
I didn't want to be sticking my fingers in anybody's crevices. He was an amazing guy. I have to, when, later I'll have to try to remember his name because I'm sure you knew him. When
Nicholas it could have been Dr. Nicholas.
it
He's
sound, yeah, I think it was. He was a
Yeah,
super
I think
nice
Nick.
guy, and
Yes,
he did the
a great.
manipulation.
Yes, yes, that was he was the chief. That was his expertise, for
So
sure.
tell me what got you to go from being a traditional. So I want to first say that, I know that your whole thing is like root cause. You're not doing the insurance thing anymore.
Right.
And, what shifted you from being more of a traditional doctor into taking more of a holistic approach?
Sure. No, it's a great question. So when I first started, it definitely was more traditional as far as the training that I received, very conventional. Didn't really have, I mean, medical school did give us the holistic approach, but it was still very much based on pharmaceutical treatments and doing everything according to the guidelines, which again, we still learn and utilize those to help us um, with treatment, or just really more as a guidance tool. But as I delve further, what happened was my oldest son was diagnosed with autism, and that kind of opened up my world to just more holistic medicine, more complementary approaches, because there was nothing to treat autism at the time, and nothing really, it was just starting as a grassroots movement. I remember there was Defeat Autism Now. I said, I want to, when Sam was diagnosed, I want to learn as much as I can about this condition to recover my son. I'm like, and I didn't even know anything. We didn't even get any training about autism in medical school. I mean, now, totally different ballgame, right? Back then, it was like 1 in 150 kids. Now it's at 1 in 31, even more. But Dan or because now was a grassroots movement of physicians with kids or other providers with kids with autism, and he's trying to figure out how we can treat them. So it was looking at whole picture and looking at various taking thorough histories going back to like pregnancy and C-sections and breastfeeding. I'm like, oh my goodness, I never thought of like delving that far into the history. So that kind of started me down the road of like not only looking into like Sam, but then other kids with autism. And then I started taking that approach with the whole practice. I'm like, well, why am I just doing this with autism? I should be doing it for high blood pressure, for diabetes. Why does somebody have diabetes? I should just be like, you've got diabetes, go on a diet, here's medication, and I'll see you in 3 months. Like, why? What's going on? Is somebody not, are they under more stress? Are they eating poorly? Do they have an infection? Do they have something, a dental infection, gum disease, something that's causing inflammation in their body, that's increasing their stress hormones, that's elevating their sugar, which leads to more inflammation? So it's getting to all these different pathways and just trying to figure out, like, hey, there has to be some underlying factor or factors that's precipitating all of this. So it's my road started, I would say, with Sam, my son, where it just opened up into doing more related to that holistic approach. I mean, I had the foundation from training, but he opened my eyes to it more.
Wow, that's pretty, I mean, that's really impactful. And, I wonder if you would have stumbled on it anyway, like,
Hard to say. It's a great question, and it's the patients that I've treated over the years who have helped me, because so I started going to more of these conferences and learning more about the natural approaches, because much of it was supplements and lifestyle uh, interventions. Again, there was no conventional prescription treatment outside of for behaviors for the kids. So and then autism, I started learning more about autoimmune disorders and kids that had other comorbidities because their immune system was impacted, by the autism or whatever was causing their autism. Because again, we can't just say it's autism, but each kid with autism has a different etiology of the autism. Right.
right.
So we always say if you've seen one kid with autism, you've seen one kid with autism. And you could say that really with any disorder or any condition in the body. So like I said, that branched out into like learning about almost any condition of just keeping to peel back that onion layer to figure it out.
Well, and that goes back to again why the history is so important because, like for me as a chiropractor, I deal, when I was seeing patients, it was mainly back pain, right? Or headaches or neck pain. I could have 10 people walk in with headaches and have 10 different answers.
Right.
While chiropractic and adjustments are my main thing, I still look at diet and what kind of injuries the person has sustained and if they have a bad seat, like if they're sitting poorly. And so everybody is different, and working with a doctor who really understands that is essential, because otherwise you could be spinning your wheels, and it doesn't mean you're not going to figure it out. And that's the one thing I will say about chiropractic is just by getting the adjustments and getting the nervous system to work better, a lot of things do clear up. But if the problem is if the person's going out and eating McDonald's every day, and I'm sorry, McDonald's, but your stuff is not very good, or you're continue to do like drinking soda. I don't even have
Sure.
to give you a name for that. But if you're high fructose corn syrup, if you keep doing that stuff, you're going to keep, well, chiropractors call subluxating the spine. That's going to
Sure.
affect the nerve flow to the organs. And
Yeah.
you're never really going to fully get better if you don't address that cause. And
Right.
autism is, to me, I've worked with some people with autism, and I say people now where I used to say kids because a lot of these kids are now adults, and it
Yeah.
is very, finding the right doctor is got to be very challenging, especially if they haven't had the training and understand that, yes, it's behavioral, it's gut, it's inflammation. There's so many things. And, to me, like when you do like an initial consultation with somebody with autism, I assume you're spending a lot of time with that person.
Oh, yes. Yes. At least an hour we allot, like we're in traditional, conventional assessment, it would be again 10, 15 minutes, maybe a half hour, you'd say, for like a new patient, but it was never enough. And some cases we have to go 2 hours. It depends. But yeah, it takes an extensive history in order to figure out what is causing or what caused the autism or what's continuing to create this, neuroinflammatory response going on in the body.
Yeah.
So
And I do want to, let people know that are listening that, Larry and I are going to be doing regular interviews. We're going to have regular, I want to call them conversations rather than interviews, because there's a lot of information that people need. And, hopefully we're going to be tackling different subjects. We're going to have something called Ask the Doctors, where if somebody, let's say, has a problem that they're frustrated with, they can submit the question. And, Larry can talk about from his a little more medically oriented. I can talk about from my perspective. And, we just want to see people get help. I mean, I think that I know you well enough that that seems to be your driving force is helping our community, whether it's, in America or in your town, because you do
sure.
telehealth sessions now too.
Yes, that's right. And yeah, back to helping people. That was one of the driving forces getting into medicine as well. It's just like saying, hey, I love helping people. And then, with the science and with doing the volunteer and the doctor, all those things. So it just made me think, yeah, I want to be helpful however I can to support and provide advocacy for anybody. Um,
So when
so
you decided to go from the insurance model to, I guess I want to call it pay for fee, pay for the visit, or I know you do more of a membership model.
right.
Um, I, it seems like it's more popular now, but I assume it was a little challenging.
Right. So yeah, it's the direct primary care model or DPC. And yeah, the benefit of BPC, or there are multiple benefits, but it's having that time with patients. You don't feel like, yeah, you're in that on the treadmill and you're running behind. I was always an hour and a half, 2 hours behind. I always wanted to spend the time with people, but economically, in order to keep the practice afloat, you needed to see a certain amount of patients in order to be able to take care of the overhead. In this model, you don't need to do that because the membership is taking care of it. So it's not about the quantity of patients you're seeing. But yes, I mean, you need to have a certain amount of members, of course, to take care of the overhead. But you're developing much stronger relationships because you're going to have a smaller panel. Um, if you want to take good care of people, you can't have thousands of patients. It's just hard to get to know them very well. Um, and then you're needing to see, when you have large panels, they say on average you're seeing about 1% of your patients per day. So if you have the average doctor has a panel of, I think, almost 3,000 patients. So you're going to be seeing 30 patients a day. It's a lot of
That's a
patients to
lot of
see.
patients. Eh,
Yeah. And in the DPC model, so you're going to cap out at 600 patients. So 1% of that is six a day. So if you have an hour per patient, 6 hours, that's, a good amount of time. And it's not the stress, it's not the rigmarole of the traditional practice. And a lot of physicians are just burning out in the traditional fee for service model because, you can't keep up with that pace for too long. And now I've seen many residents coming out of training that are going straight into direct primary care because it's more old school. It's more like the Marcus Welby type of practice, you know.
right.
You're really just you're taking care of patients, spending the time with them, and it's not refer here, let's get this test. It's like as we discussed, giving ourselves the time to just explore their histories and investigate what's going on with them, given the time that they truly need and we need to figure out what's going on.
And also a lot of the, what the traditional medical models also I believe are owned by like corporations, right? So you have more or hospital systems. So you're driven by making sure that they're happy, that you're seeing enough people and maybe ordering enough tests and right. I mean, I assume they have like these, goals you have to meet. And to me, that's not patient centered. That's really profit centered.
It's profit driven. Sure, sure. Yeah, you're right. It's about the numbers, and they need for the providers to be profitable in order for the company or the corporation to be profiting, right? So yeah, and that's I think part of the stress for many practitioners is, hey, I've got to keep up with this amount. Otherwise, they're on top of it. Like you lose autonomy when you're part of a system. And nowadays, the majority of practices are owned by one of the hospital systems,
Right.
just because of the nature of the current paradigm.
But and then you got these other factors like the school debt, the student loan debt that these, doctors are coming out of school with.
Right.
So, that associate position that is being dangled in front of them might look good, but it's like they're just coming out of 8 years of hell,
Well,
like, the
no, you
residency and being on call and having to cram all that information into their brain, like
sure.
to me, I was originally a pre-med major, right? That I had started out, I didn't decide to become a chiropractor until the age of 29. I was originally in undergrad for pre-med.
Yeah.
And, I just felt like it wasn't going to be for me, but I looked into it, and clearly the lifestyle of a medical student is insane. And I feel like they get caught on that hamster wheel. Like they got to go into these, traditional practices because they're worried about paying back their student loans too.
Absolutely. Yeah. I mean, the average medical student now is coming out with over $500,000 in debt. And then to come out and say you're going to start up a practice. So then you have to get a business loan. And so many, and a lot of physicians tend not to have the business savvy, coming out of medical school. I mean, unless have an entrepreneurial mindset, but most just, want to take care of patients and, go into medicine. So, it's more alluring to come out and say, hey, you're going to get a, paying job right away. You can take care of start paying off your loans versus going more in debt and not having a guaranteed salary. So that's why you're not seeing as many, you know, residents coming out now going right into hanging up a shingle like they did years ago. And then primary care is also having a shortage because of such high debt. Primary care is getting paid about half the salary of what the specialists are from these corporations. So most residents are saying, like, I'm not going to go into, even if I love primary care, I'm going to pursue a specialty because it'll just pay off my debt that much more quickly. And
Right.
I'll be earning more in the future. So that's why we're having some more trouble, as far as with primary and a lot of primary care docs are burning out because yeah, they just can't keep up with that, the rat race of on that hamster wheel of seeing patients that rapidly and not being able to provide the quality care.
Yeah. And, I assume you know this being, when you graduated from an osteopathic school back in 96, the history of osteopathy was you were manipulating, they called it manipulation. They were manipulating the spine to allow the blood to flow better, for
Right.
improved circulation to help heal the body. And chiropractic it was about freeing up the nervous system. And I think both are vitally important. And when you do the adjustment or manipulation, you're certainly affecting both. But
Absolutely.
I don't know if you know who Candace Pert, I want to say was, I don't think she's around anymore, but she had done this study. I had the opportunity to see her speak in the early 90s after I graduated. I moved down to DC and she was speaking to a small group of people. I think she wrote the book Molecules of Emotion. It was about the psychoneuroimmunology, basically. So it's just about how your thoughts, like the practitioner, when they work with the patient, that can affect how quickly they do better just by you thinking about I want to see this person healed and you sending them like good vibes or juju, like they will get better results. There's actually studies on this. So
Yes.
when I saw her speak, she actually talked about the study that they had done, and I realized, like, I think like with chiropractic versus, let's say, PTs who do manipulation, they're really coming from a strictly mechanical perspective. They're not looking at the psychological impact of the person providing that adjustment or manipulation. And I was wondering, like, if you were aware of that, or well, because I know that you do manipulation in your practice, is that something that you bring into, into your practice when you're doing hands-on with people?
Sure. No, I really enjoy using my hands. I mean, years ago, I wasn't sure how much I would implement that in practice, but I'll tell you, especially with when it comes to like acute injuries, many people coming in, that have strained their neck or strained their back, immediate relief, but we've had many people who just have chronic, somatic dysfunction or other conditions that are leading to uh, bodily dysfunction where treatments have just been tremendous for them. And I've had or I have some people who just come in steadily because, yeah, it helps them mentally as well. Like it just they have so much better of an outlook after a treatment, and so they'll continue to come in like on a weekly basis. I mean, we're still working on the foundational principles, like you mentioned, like diet, exercise, sleep, stress, but they just it's like the endorphins increase, with the treatments, and it makes them feel that much better. So no, I'm a firm believer, in that.
Right. So yeah, they've actually done studies showing that there is a boost of endorphins. There
Yeah.
was actually a study done, I want to say in the 80s, with people with HIV. And it was a chiropractic group that did this. And it was for upper cervical only. So it was either adjusting C1 or C2. And they actually found that the immune system improved. They actually showed more white blood cells that were produced. So they did a blood sample before the adjustment. And I think it was like 15 minutes afterwards. And they saw a jump in that. And because I would see patients in my practice all the time start getting healthier, people that had chronic illness, or
Yes.
very often I'd see like one person in my practice and they would get healthier, but meanwhile their family was still like the bug would go around the family, or maybe, I would see a child in my practice and she'd be the only one not getting sick in her class.
Right.
And, like to me, I got to see that firsthand, how people's health was getting better. And I
Sure.
was wondering, like, do you look at that? I mean, have you considered adjusting people for just overall chronic immune system issues?
Oh, yes, absolutely. I'll do a structural exam to see if there is any dysfunction at any level in the body, and see if that is going to help with any condition, whether it's related to at the abdomen, the chest. Yeah, because there many diseases, as you're mentioning, are related to neurovascular dysfunction. So,
So,
or
so,
compromise leading to dysfunction.
so do you like palpate the spine, or okay, so you're doing like a
Yeah.
motion palpation kind of thing?
Correct. And not just the spine, but other joints in the body as well. So, but mainly the spine when it comes to diseases in the body, because right with the nervous system stemming from the spine, but also, I can work on shoulders, knees, wrists, other joint dysfunction as well, or like carpal tunnel syndrome, for instance. So, yeah, yeah, it's been very helpful to utilize those skills.
Now, do you do cranial sacral as well?
I do some, not. I was trained in it, but I haven't had enough patients over the years, and I didn't go for more extensive training of it. It was just a very small portion of our osteopathic manipulative training. But I have had over the years some patients come in for craniosacral.
Yeah, there's a PT, John Barnes. Are you familiar with the John Barnes Foundation? They're
I
in
know of it.
Paoli or Malvern. I actually did a weekend seminar with him before I even went to chiropractic school. And,
Hmm.
he does his own version of, cranial work and myofascial release. And I have to tell you, I used the stuff I learned from him all during the times I practiced, whether
Oh,
myofascial, like there's a shoulder pull, like an arm pull you do for like frozen shoulders, but he does the suboccipital release. So maybe I'm not doing a full blown cranial, session, but really good stuff. He goes between Arizona and Pennsylvania, so you're not likely to catch him until,
yeah.
the spring. I'm sure he's gone
Yes.
already for the winter, but it's something you may want to check out. He's top
Yeah,
notch.
no, that's great. I'm
Yeah.
always looking for craniosacral specialists to help.
So if I mean I don't know, like it seems like you see a variety of people, but do you have like an ideal patient? Like do you want to see like somebody with certain specific issues more so than others, or are you just happy to have whoever wants to come by and get help?
Anyone really. I mean, I've worked on, many of the chronic diseases, if you will. Whether it's been a lot of the pediatric ones, autism, PANS, ADD, ADHD, and then, anxiety, depression, migraine headaches, mast cell activation syndrome, mold toxicity, Lyme disease, like some of those chronic illnesses that can become quiescent and then get exacerbated by some stressor. So I do enjoy those because it's really delving into very deep histories. I mean, I like to do that in general with everyone, but those tend to be much more involved and it can be complicated, but it's very rewarding to work with those patients when you're seeing the improvement um, amongst them. But no, so really, I love seeing, kids and adults and with acute conditions, chronic conditions. And like I said, I take a similar approach and really it's personalized and it's taken that holistic view of the body as we discussed and to try and get to the bottom of what's going on with each and every individual.
Great. So we're like almost out of time. Before we go, I would like you to share your contact information. If somebody would like to schedule an appointment, what your website is. I want people to be able to reach you if they want to,
Oh,
come in to see you.
oh, sure. Thank you so much for that, Nancy. Yes, and the name of the office is Hearthstone Family Care, and the website is hearthstonefamilycare.com. And then my social handles, Instagram and Facebook, are also at Hearthstone Family Care. Um, and yeah, so you can reach out to me through Facebook, Instagram, message me. You can schedule a meet and greet on the website, and then we would discuss the practice and see if it's the right fit for you. And so, yeah, I really would love to. I welcome anybody to come to the practice.
And I'll put your contact information in the notes. And I just want to remind everybody that Dr. Larry and I were going to start doing these regular sessions. We may talk about mast cell activation one week. Maybe we'll talk about one of my big things is cholesterol. I just drives me nuts how cholesterol's and so we're going to be talking about a lot of different topics. There might be something that's current that's in the news that we want to tackle. We're going to be answering questions, so feel free to join my Facebook group called Blueprint to Heal and join that. And then once a week, we're going to ask for people to submit questions that they would like to have answered, and we'll pick one or two depending upon how much time we have. And I want to thank you. I think we're going to hopefully help a lot of people through this podcast and just, reach more people that need help, that are frustrated, that are just tired of the runaround. And so thank you for coming on today.
Oh, thank you for having me, Nancy.